Can you take allergy tablets and omeprazole together? That's a really common question, and the short answer is yes. For most people, these two medicines are generally considered safe to take at the same time. Many people in the UK are managing both allergic conditions and acid-related problems like gastroesophageal reflux disease or GORD and gastritis simultaneously. So it makes sense that this combination comes up a lot. Omeprazole is a proton pump inhibitor, or PPI. It works by reducing the amount of acid your stomach produces. Antihistamines like cetirizine, loratadine, and fexofenadine work completely differently. They block histamine receptors to relieve allergy symptoms like sneezing, itching, and a runny nose. Because these medicines act on entirely different pathways in the body, clinically significant interactions between them are unlikely for most people. There's also a pharmacological reason why these combinations tend to be well tolerated. Omeprazole is primarily broken down via an enzyme pathway called CYP2C19. The second-generation antihistamines, cetirizine, loratadine, and fexofenadine, are not significantly metabolized through that same pathway, meaning they're unlikely to interfere with each other in a meaningful way. The BNF, the NHS, the MHRA, and the EMA have not identified clinically significant interactions between omeprazole and these standard antihistamines. It's worth knowing a little about the different options. Cetirizine is primarily cleared by the kidneys and is generally safe alongside omeprazole, though it can cause mild drowsiness in some people. Loratadine is non-sedating at standard doses and is often a preferred daytime option. No special timing is needed with omeprazole. Fexofenadine is also non-sedating with minimal liver metabolism. One practical note with fexofenadine: take it with water rather than fruit juice and separate it from antacids by at least 2 hours. Acrovastine, found in some Benadryl products, has no documented clinically significant interaction with omeprazole either, though it can cause drowsiness in some individuals, so be mindful if you're driving or operating machinery. What about older, first-generation antihistamines like chlorphenamine? These can cause sedation and anticholinergic effects, particularly in older adults. Omeprazole doesn't directly worsen that sedation, but it's still worth being cautious, especially if you're over 65 or taking other medicines. It's also worth checking the active ingredient on the label, as brand formulations can vary. Now, when should you speak to a healthcare professional before combining these medicines? If you have liver or kidney impairment, if you're pregnant or breastfeeding, if you're over 65, or if you're already taking several prescribed medications, please speak to your GP or pharmacist before starting this combination. Individual factors like these can influence how your body processes medicines, and a healthcare professional can help you make the safest choice for your circumstances. And never adjust your prescribed dose without speaking to your doctor first. If you do experience any unexpected side effects, report them to your GP or pharmacist. You can also report suspected side effects directly to the MHRA via the Yellow Card scheme at yellowcard.mhra.gov.uk. So to recap, allergy medicines like cetirizine, loratadine, and fexofenadine are generally considered safe to take alongside omeprazole because they work on different pathways and don't share the same metabolic route. That said, individual factors do matter. So if you have any underlying health conditions, you're on multiple medications, or you're in a higher risk group, always check with a healthcare professional first. If you have questions about combining medicines, drop them in the comments. And for anything personal to your situation, your GP or pharmacist is always the best person to speak to. If you found this useful, give it a like and subscribe to Bolt Pharmacy for more evidence-based health information.